Okay, the topic of today is electroshock, especially because there was an international demonstration against electroshock in many cities around the world on the 16th of May. This is very interesting that there is a treatment that is perceived as so damaging by patients that they actually stage protests. We don't see this anywhere else in the world when it comes to other medical treatments, but okay, here they've done it against electroshock. And there was a big debate on Mad in America afterwards about the merits of electroshock, where one doctor, who was anonymous, claimed that there is evidence for the need for electroshock, that it's necessary to use electroshock on some patients. And he referred to a few scientific articles which had compared electroshock to sham electroshock. That means that the patients get everything apart from electroshock, including the anesthesia, the muscle relaxants and everything. And with the typical phrases that electroshock today is not like it used to be. Okay, so how come he can show 3 articles that show effects of electroshock? This is because these studies, they use short-term effect as the measure. Electroshock is better than sham electroshock for the time that they're using it and up to 4 weeks afterwards. But after that, there's no difference, and there's actually a tendency for people who've had electroshock to do worse. The suicide rate goes up with people who've had electroshock. Not to mention the damage that is done to the brain. The Nobel Prize winner P. Bram said that he would rather have a small lobotomy than a series of electroshock. A brain that has been exposed to electroshock is not a pretty sight, he said. And this has been shown on several studies that there are a lot of bleeding along the path of the electricity in the brain, and that there is brain swelling due to the trauma that the brain has been exposed to. And the energy that is in each electroshock is corresponding to putting a patient on the ground and taking a kilo stone and dropping it on his head 17 times from 1 meter high, 170 kilojoules. So there's a lot of energy that is put on the brain, and it's corresponding to beating with a baseball bat. But you have to beat really hard. You could take a 17 kilo block and drop it from 1 meter. That would be the same. So electroshock is not proven to be effective for more than 4 weeks, and then at an extreme cost, especially memory. Many people don't remember their education, they don't remember their spouse, they don't remember their children or grandchildren, and they are generally much more passive. And in some cases this is considered the cure. This is considered what people are cured from. They have been very agitated, and electroshock can make them become very passive. So it's quite logical that you can get good results from research depending on what kind of symptoms you measure. If you measure the amount of complaints from the patient, they are so confused they can hardly complain. If you measure that they are quiet, this can probably be the case for instance, demented patients who've been very agitated, maybe because of pain. After a few electroshocks, they're so confused that they cannot even be agitated. So, electroshock is a treatment that probably should be abandoned. There's another argument that is popular in America, that people must be allowed to choose this if they're given informed consent. But the big problem is, who is going to author the informed consent? How is every aspect of the problems with ECT going to be explained to a patient who is in crisis, or to a family who wants nothing more than the relief for or their loved one. They are not going to be normal recipients of information. They cannot process the information. They would agree to almost anything. Many patients would agree to being killed. Just kill me, they say. They are so suicidal and hopeless that they would agree to being killed. So of course they say, okay, if this electroshock can work, I'll take it. I don't care about my memory. I don't care about my life. So to give informed consent privileges to a person like that and think that doctors who are for electroshock has any possibility at all of giving enough information so that the patient can consent in an informed way, out of the question. And should we let people do things that are damaging to their brain just because they want to? We don't let people use drugs if they want to. We have prescriptions, we have laws against using amphetamines, marijuana, LSD. We don't let people do whatever they want to their brain. If it can destroy their lives, we don't let them do that. So why would we let people do a treatment that is dangerous to their brain?